Hi, thank you for tuning in to Global Elite Consultant. Today we're going to talk about how to open your home care agency in Seattle, Washington. Please press like and subscribe and share this audio with someone who you may think need it. Now, so we're gonna do Seattle, Washington, how to open your home care agency. Now in Seattle, it's definitely different processes. So a non-medical home care agency is personal care, bathing, dressing, toileting, meal prep, light housekeeping, companionship, medication reminder. You don't have any it's not skilled nursing, so you do not need any special nursing skills. So you have to fill out an application to the okay, so first let's start with what is it required. You're going to register your business with the Washington Secretary of State. Then you're going to choose your are you opening up like a LLC or corporation? Then you're going to obtain your UBI number, which is a special number that you use within Seattle, Washington, or within Washington to identify your business. And you get your EIN number from irs.gov. It'll give it to you immediately when you fill out the application. And then you open up a bank account. You're going to apply for your license. Now, so let me go back to this UBI number because I want to explain that, because this is just within Seattle, Washington. So this UBI number, you automatically will receive this UBI number when you register your business with the Secretary of State, or when you apply for the Washington Business License. You don't have to apply for it separately. When you apply for your business license in Washington, you'll get it, or at the Secretary of State when you register your name. So where do you find this number at? On your Washington business license, you should have on there, it should be your UBI number, or on a letter from the state, or in your Secretary of State online account. So this UBI number is Washington Business ID. It is required for home care. It's issued when you register your business, as I said before, and it's required for home care license. It's a 9-digit number. So it's not the EIN from the government. This is a separate number that you use within the state of Washington. You'll need this UBI number to apply for your home care agency license, to get your Seattle business license, to register with Washington Department of Revenue, to hire employees, to apply for Medicaid if you wanted to apply for Medicaid, to file your state taxes, and to be able to get workman's compensation. So that's a very That's a mandatory number that you would have to get. It's called UBI, and it's only for the state of Washington, Seattle, Washington, only for the state. So if you're in another state other than Washington, you don't have to do a UBI number. This is only for Washington. Now, when you apply for your home care license, the initial application fee is $3,283. Wow, they're really expensive. Well, in Denver, I think it's 2,200 and something. So, yeah, so that's $3,283 to apply for your when you want to put in your application. Wow. So now after you, so you get that, then you're gonna go to IRS.gov to get the EIN number, because you need that. The EIN number is your federal identification number. So you're actually gonna have two numbers. So after you after you apply for that, that's the things you have to do to apply for that. And then you will go on, and there's a mandatory home care orientation for Washington, for the people who live in Washington. It's required. The orientation is required before you can apply. So you'd have to take the orientation first, and then you would put in your application. It's called the In-Home Care Orientation. It's offered online or in person. You get a certification after you finish. And it's required that the certification that you get, you have to attach it to your application when you apply for your state license. You have to take that certification and attach it to that application. And they just says that it's non-negotiable in Washington. So you have to take that orientation class. Okay. So when you apply for the license, you're going to have to submit the home care agency application, the orientation completion certification, the application fee of $3,200 and whatever it was I said, proof of general liability insurance, and then make sure for the administrator background check, they have to have a disclosure statement, organizational chart, staffing plan, and policy and procedure manual. Now, we can help you get your policy and procedure manual. We'll make it up for you for Seattle, Washington. It's usually 8 binders. And then if you're going to get IHSS, which is low-income patients, we will also do a 9th binder for you. But you can contact us at globaleliteacademy.net. Go on there, either fill out a form for us to call you or get the phone number off there and then call us. globaleliteacademy.net, and we will help you get your policy and procedure manual. Now, it says here that you do not need patients yet to be licensed. So maybe they let you get patients while you're waiting on your application. We have to look into that a little bit more. Okay, so for the home care administrator, this is what they require for the administrator: at least 21 years of age, background check clearance, experience or training in health or social service, and responsible for daily operations and compliance. So that's what you'll need as an administrator. Okay, so now we can help you. The policy and procedure is going to be very important, and we charge. Well, just give us a call. We'll let you know, because I'm not sure. I have to look it up and see, but it's going to be anywhere from 2 to 3,000. I'm sorry. Is it 2,000? I think it's two. I think it's 2,500. I'm sorry, 2,500 to 3,500, because it depends on if you need the binder 9, which is for the IHSS, and you're going to need that too. If you're not getting that and you're just opening up a private pay agency, then it's 2,500. But if you want us to include IHSS, low income patients, and you're going to take those, then it's 3,500. And you have to give us a little time to get the policy and procedure manual together. Usually a few weeks will take to get it together. But usually you have to go through that when you're going to be surveyed for your license. And so we'll have it ready by then. After submitting your application, you will be scheduled an on-site, that's what I just said, or a virtual survey. They will review your policies, your staffing files, your training plans, and your administrative system. So that's what all they're going to do. For hiring and registered caregivers, the caregivers must pass a Washington background check, complete required orientation and safety training, have a TB test, and other screening rules. Usually a flu test. Usually a flu, usually the flu. If you can't take the flu if the caregiver can't do the flu because of religious reasons, they need to have a letter from the doctor, and usually you have to have them sign something saying it's against the caregiver's religious to get a flu shot. Okay, so if you're planning to get Medicaid patients, then you must also register with the Seattle, Washington Department of Social and Health Services. Now, we can help you with that as well, but what I was talking about is IHSS is the community-based service, and I'll put that on another video, how you enroll in that. But you definitely should enroll for community-based service, because those are low-income people that needs private duty in their home. And it says here that you can also, when you're doing the regular application for the non-medical home care, you can also do an application for the community-based service. So you can do them both at one time and get that over with, which is really good. It takes approximately 60 to 120 days for everything to go through, depending on your paperwork readiness, how ready you are. Okay, so if you have any questions, go to our website, which is globalelite.net. That's globalelite.net. Get our phone number or fill out a form for us to call you. And then we can help you with this. We can also help you with the one-on-one if you don't want to, if you need more help, if you need help with the license and things like that, give us a call and we'll help you do the license and all of that for a fee, but we will help you do that. Thank you so much for tuning in. Have a good day.